So as usual, we have this month's a monthly seminar we are having in a short while from now. And in fact, every time we used to request foremost our founder chair to say a few words about the UHR Center, and then he in turn will ask our Professor Dr. Paramesh to introduce speaker. Today, our Paramesh sir is playing a dual role. So we are very lucky. So we are very lucky to hear his talk, and he will be sharing his experience about his visit to Mexico. So with these few words, may I humbly request our founder chair, Professor J. Srinivasan sir, to say a few words, and then ask Dr. Paramesh to give a talk. Thank you, sir.
Welcome you all for the monthly seminar that Paramesh organizes. And he doesn't want to miss any month, so he has volunteered himself. And we're all very happy to hear him talk about neurocognitive development in children. Dr. Paramesh.
Respected J. Srinivasan sir and distinguished students, and I'm really thankful to share some of our thoughts here regarding the environmental impact, neurocognitive development in children. So I, being one of the co-chairman we organized this program in Mexico International Pediatric Convention, Mexico City, Mexico, along with Ruth Edsel, she's the past president of American Academy of Pediatrics, and David Gitanga, he is from Kenya. He's a pulmonologist. We three of us organized workshop in Mexico. During that time, we wanted only 40 people. We had 60 people, and very well. They all enjoyed it, entertained it during that talk. When I came here, some of this, why you are giving there? Why can't you give a talk here? The same thing here. That's what made me to this month. This is the month for the environment and brain tumor. So combined with the environmental issue related to the brain only, I think this seems to be somewhere it's appropriate to that. Having said that, this is the workshop what we had, and what we see, David Gitanga is here. Yes. And she is the lady, and Kumis and Kingdom. She is the air quality director in UK. And myself, Ruth Edsel, she is the president of the past president of American Academy of Pediatrics. Currently, the Air Quality Index of America, she is one of the members. And next is that lady is from Mexico. This is the lady and then PhD in chemical air pollution. Only her, mainly in lead and mercury. So other organizing people. Now, what is neurocognition development means? It is a mental process of acquiring knowledge and understanding by thoughts, perception, by experience, senses, and effective response. The preschool years are the blossoming of the brain. For 1,000 days after birth is the most important, because most of the brain develops at that time. So during that first year of life, 1 million neuronal connections are made per second. And the synaptic density reaches its peak through the third year, the first 1,000 days of life. The physical development is easy to see, but not the cognition. cognitive brain development unless we open the head and doing all those things. It has been done in dogs. I think I'm not comfortable with that one in Mexico. It has been done. I'd like to show that slide later on. The measures for successful integration, successful cognition development, we need good collaboration between physicians and societal stakeholders. And we have to have a good goals between the partners. Investment with clear communication. Cognitive phenotype coexist with any motor abnormality. If you look at the brain, the intellectual disability and attention deficit disorder on the front portion of the brain. It's always will be there. In addition to that, the artistic spectrum has got in the lateral part of the brain, temporal lobe and the frontal lobe. Air pollution, climate change, what are the cognitive disorders? WHO in 2023, they analyzed what are the key cognitive disorders. During that, they found out the worldwide cognitive disorders, 240,000 in the first 4 weeks of life. And 170,000 in the 1 month to 5 years. These are all the cognitive disorders they appreciate. Which contribute a long-term disability on psycho-socio-economic burden, predominantly low and middle class income countries, individually, family-wise, healthcare facilities-wise, and society-wise. The common congenital disorders they have appreciated 2023 is the cardiac defects, neural tube defects, and Down syndrome, that is Mongolism. If you look at the environmental pollution and windows of development, the first weeks of conception is most what we call prenatal. The period for dividing the zygote implantation, usually nothing will affect at that time. In case if something unusual happens, you can have a prenatal death. But second week onwards, up to the full term, then the embryonic stage along with the fetal stage period, and neurologically everything is affected. Red one, where the major abnormality occurs. The yellow one, minor abnormality and physiological abnormality going to occur afterwards. So neurologically you have beginning of the 3rd week up to the mid of 6 weeks, major abnormality happening, environmental pollution, anything going to happen. Afterwards, minor changes going to happen. Various other organs have the same way in this context. What are the usual type of disabilities? It is a visual, hearing, mental health, intellectual, autistic disorders, physical disability, arthritis, cardiac and respiratory defects. These people have the barriers. What are the barriers? Attitudinal, social exclusion, systemic or organizational, physical or architectural, communication of information and technology. These people face horrendous problem in this context. How do you recognize these impairment? What are the clinicians? You can also identify these things and doctors can confirm those things. These are all the forgetting things frequently. Second thing, missing social commitments and appointments. If you have wedding you have to go, you go next day, you say nothing there. These are all type of things. Next, trouble following the conversation, losing the frame of thoughts, trouble finding the right word or with language, hard to make decision to finish the tasks. If you look at the healthy brain, how it looks like anatomically, and mild cognitive dysfunction, that is the brain. The impact of air pollution, neurocognitive, if you look at that, air pollution is an impact womb to tomb. 99% of the people live in the world where air is considered unhealthy. Our mothers and children need a clean and safe air to grow up healthily. Air pollution cannot always be seen, but look after polluted air if you can see a gray haze and yellow haze. As I said, air pollution has an impact from womb to tomb. It is an invisible killer. 43% of chronic lung diseases are from the air pollution. 29% of the lung cancer is from the air pollution. 25% of the cardiovascular disease, 24% of the from the stroke, these are all the most common things. We have been seeing heart attack much earlier than what it is earlier. I think when you talk of the pollution, pollution has got the particulate matters, solid particles, and also gases. But the size of the particulate matter, whether the gas is a water soluble, is important. Why? Because it tells which part of the brain and body it affects. If we have 10 micron and above, and water soluble gas, predominantly sulfur dioxide, they affect the upper respiratory tract. Upper respiratory tract, eyes, nose, pharynx, and larynx from here to here. Those are predominantly affected, 10 micron. And less below 10 micron up to 2.5 micron affect the lower airway obstruction. So, and also the ozone is a medial, it's a water soluble. It affects the tracheitis, bronchitis, bronchiolitis. Sometimes alveoli go there, alveolitis and pneumonia. Less than 0.2 micron, that will cross the 7 layers of the lung, enter the bloodstream, the small clots, and deposit it in the fetus placenta and distribute all over the body. All the vital organ is affected. That has been shown by the radioisotope study. I think recent study has come from USA. The standard water bottle, 1 liter water bottle, it has got 240,000 particulate matter. Drinking water bottle. And more than 90% of them are less than 0.1 micron. They will enter the body all over. You can see in the brain also. So this is one thing. I think 2019, we had water conference here. Indian intestine given no glass bottle, no plastic water. That's why we are giving the water there. We don't give the plastic water there. So this is what we have to look into these things. And impact of air for human health. You have upper airway. You heard about it. Conjunctivitis, rhinitis, sinusitis, middle ear infection, laryngitis, pharyngitis. All these things will come then. Lower airway, you got tracheitis, bronchitis, bronchiolitis, pneumonia, and those are the things. And the small airways, the small particle less than 0.2 micron, when they cross the layer, enter the bloodstream, at the mucous membrane, small platelets aggregation will happen. Those are all called platelet coagulopathy syndrome, we call it, new term. That will travel all over. If it deposits on the placenta, it affects the nutrition of the baby. Depending on how severe it is, you have stillbirth. If it is little less, you have premature birth. If it is little less, you have small for day babies. But these babies were born with, they are born with a small airway caliber. Small airway caliber. So they get repeated bronchitis, bronchiolitis, pneumonia, and later on persistent asthma, COPD. They die pulmonary handicap. So that's a fixed airway obstruction. It's called a new term. It was not done earlier. For the past 10 years, we have been seeing it. Allergic airway diseases are the earliest onset non-communicable diseases. So what other, apart from pulmonary, lung plays the major role. That's why we focus there. Non-pulmonary diseases, coagulopathy syndrome, we already mentioned about it. Blood pressure, cardiovascular diseases, stroke, cancer, diabetes, and obesity, baldness, liver disease and cancer, chronic kidney disease are related to air pollution, small particle, 2.5 micron. So impact of air pollution, central nervous system, autism, dementia, Alzheimer's disease, cognitive performance, anosmia, neurodegenerative disease has been appreciated. This from the air pollution development. The healthy brain, you can look at, see Alzheimer's disease, you can see it. And air pollution, behavior problem and polluted air, increased crime rate, impaired judgment, voltage scores and polluted dates, reduced productivity in work, immune suppression also it happens, you get more infection, immune suppression happens, depression, decreased intelligence quotient, increased anxiety has been appreciated. The traffic related pollution and the lung and the brain, the antenatal exposure is energized with the postnatal exposure, with increased susceptibility to wheezing, bronchiolitis, and asthma. In addition to that, it affects the cognition, behavior, psychomotor development in children, and dementia in elderly. Air pollution impact on the brain before birth. Air pollution particulates matter have been seen in the lung and the brain of the fetus. It has been found on the first and second trimester placenta as well as in the fetal organs. Mothers exposed to nitrogen dioxide during first and second trimester had children with higher behavior problem. These are some of the particulate matter you can see. Exposure to urban pollution from fossil fuel in New York City in utero, and those children followed up to 67 years, they showed deficit problem with anxiety and depression. Further, same thing in Utah, in USA, 2.5 micron on the third grade student, 150 of them, the proficiency in mathematics and English language showed significant reduction. Further to that, the study done in Boston school, public health school, over 2 children from birth to 10 years they followed. What they found, children exposed to black carbon. Black carbon is also aerosolization. It comes to aerosolization. Had the lowest score in memory and verbal and non-verbal intelligence quotient test. The idling the diesel-powered school buses were retrofitted with engine in 2009 to reduce the emission. It has been in Georgia, USA, which resulted in increase in the students in English and English test score and some improvement in the mathematics as well. The dog's brain from polluted and non-polluted environment. This is the study they take in the highly polluted city. Mexico City earlier was the most polluted city in the world. They cut open the brain, look at the brain of the dogs. And other dogs were in the normal air pollution is not there. They found out brain of the Alzheimer's like were there in the dogs in the polluted area, which is not there in the normal brain compared to Mexico City dogs. Brain show increased inflammation and amyloid plaques, which look like Alzheimer's disease in comparison to other dogs from the non-polluted area. So Calderon and Softship, they also done earlier the allergic particulate matter, how it affects the nose. So these same people have done this study also. And children of polluted Mexico City, 55 number, showed lower test in memory, cognition, and intelligence. Air pollution Mexico City capital in 2016 showed Mexico City's government has advised people to stay indoors and restricted traffic due to air pollution. Ozone levels have been measured at nearly twice the acceptable limit, triggering the first alert over a decade. This is highly polluted Mexico City. Then, now recently went there, beautiful. I like to come across those slides. Critical windows of development is the paternal environment is also equally important apart from the maternal. Why it is paternal exposure have ensured mercury, ethylene dioxide, rubber chemicals, solvents linked to spontaneous abortion. The paternal activate, if the painter, these are got anencephaly, you can see with the brain like this, there is no brain like anencephaly. Mechanics and welders, their children have high incidence of Wilms kidney tumor. And textile work father, stillbirth and premature. The mechanism probably impairment of the paternal gene, which is required for the normal growth and development of the fetus. Parental expert air pollution linked to increased risk of cerebral palsy also. The study done in 2002-2017 in Ontario, Canada. For every 2.7 microgram per cubic meter increases suspended fine particulate matter, there is 1.12% increase in cerebral palsy. The risk of cerebral palsy increase all through the pregnancy. Boys get affected more than the girls. So why girls are not suffering is the most important thing. This is the observed fact. To become a boy, right amount of growth hormone, whatever it is, hormones, enzymes, has to be the right time, right amount, right duration. Otherwise, male child will become female child. These are all the observed facts. very unusual. The nature has this one. And air pollution affects cognition as measured by verbal and mathematical score. If China were to reduce the suspended particulate matter level from to 10, less than 50 micron per cubic meter, the cognitive gains would be equal to that of an extra year of education for the entire population. And the harmful effect pollution starts even before you are born, as I said. Nearly 287 pollutants, chemicals, pests identified in the umbilical cord blood, like lead, mercury, perfluorochloropheniramine, and polychlorinated biphenyls, has been identified in the placenta, taking the blood from them. The chemical pollution, I think this is the pictures from the Kasaragod endosulfan tragedy. A lot of people suffer from that. So it is a great growing global problem. These chemicals affect the human health, is purely defined, and its contribution to ill health is underestimated. More than 140,000 new chemicals synthesized since 1950. In them, only 5,000 produced in well, and less than 50% have underwent testing for safety. Pesticide, fertilizer, herbicide are the main cause for the environmental pollution. These chemicals are endocrine disruptors and neurotoxins. The impact of cognitive development. This list is there. Prenatal maternal stress can also affect the toddler cognition in the development. That's why in our culture, after fifth month, they used to the mother's half, and third, where she's being treated like a queen. Anything food you want, any flower you want, any music you want, always smiling. This is very important. Our traditional people, thousands of years, now we are identifying how important not to give the stress to the mother. Maternal smoking during pregnancy decrease the cognitive development in children at 4 years of age. Those are all references given there. Maternal exposure to polychlorinated biphenyl PCBs leads to poorer cognitive function in the preschool children. We are even constructing the house, plastic pipes and all the things we should avoid PCBs. Down syndrome have a mild to moderate cognitive impairment. The cognitive function with the cardiovascular disease continues even, congenital heart disease continues even after cardiac surgery. Any disease, stress always will be there. Chronic problem, chronic stress. Acute problem, acute stress always will be there. We have to overcome those things. The cognition impairment in 77% of the chronic obstructive pulmonary disease and hypoxia, any condition where you have low oxygen, always affects the cognition. Any disease, doesn't matter. The cognitive phenotype coexists with any motor abnormality. So children, development period, we have to focus on all these things. Enhance their cognitive. This one. Language exposure, sensory play, musical engagement, safe exploration, immediately games. Games they have to play, small children, 6 months onwards. Physics activity, emotional interaction. These are all very much stimulating the baby at that time. Pregnant mothers on anti-epileptic medicine, they show delay in speech, especially expression language age. Noise pollution will affect the fetus. Anything more than 95 decibels, it is most dangerous. We should not. And high frequency deafness in newborn, prematurity, intra-aortic growth failure, poor school performance, prematurity, intra-aortic growth performance, they also have fixed area obstruction. Maternal asthma, adverse perinatal outcome because oxygen comes down in the mother, that also affects. Increased risk of cleft lip, cleft palate, increased risk of nervous diseases. Heat waves affect on pregnancy. Nowadays we have to consider heat waves. I think recently I was in the Copenhagen environment program, United Environment Program. During that they taken plastic, in addition to that they can heat waves. We have to consider about it. I think next month I'm going to again United Nations invited me there, Kenya, where interacting with the heat waves. We have prepared some slide. I want to hear about it. I'm going there next month. So I think heat waves, congenital anomalies, neural defect have been done. The effect of child and family environmental factors participate in the young children disability and cognition is very important. We physicians give the attention towards modifying the environment as a primary target intervention aimed at promoting health through the participation. I think participation, parents, teachers, and doctors. How often you see them, how much you are involved, how you created them to accept the change, and how to move forward. These are all the things we have to focus. That is based on the child's factor. You should know what age it is, complexity of the condition, and family factor, family income, and family functionality that take into consideration. Environmental factor, environmental resources, environmental support. These are all issues that are taken into consideration, and helping the parent do this one. But it takes a lot of time. Nowadays, time is money. No doctor wants to have spent time. I think it's a must. We have to spend time with this. And this is the one, I think this month is published in a pediatric journal, I think 9th of this month. I think it has been done in Belgaum in Karnataka. So what they did, Deepa, Medgood and all the things, the early child development intervention are an important strategy by which neurocognitive development can be promoted. What they did, they study sit down and play, like child is like sit down and play, the intervention, how it helps. They've taken a rural population around Belgaum city. These parents will go to the well-being clinic where the immunization checkup has been done. In that one, they have taken about 52 children. 16 of half of them control, half of them they're testing. They found out between the age group of 6 months, 8 months, and 10 months. Neurodevelopment assessment done at 11.8 months. The study group showed good neurocognitive development compared to the control group. I think a small group, but this is effective. And managed to maintain cognitive burden. How do we prevent this one? Prevention better than cure. Do you know who are the first mentioned about it? Is it Western country? India. It is India. Charaka Samhita, he is the one mentioned about it. That prevention is better than cure. Now other people have taken it. So let us think of our country, what we have done, a lot of things earlier. And pre-conception screening, families see in details, carrier stage of any disease, focus on consanguineous marriage, we should avoid Jyotisha Hetarla. Puja dosha karla. What is that called? So that way you should not get married in the family. We are thinking about it there. Now we are getting genetically with some of the diseases, we doing it. That is what earlier Jyotish used to tell that he has got the dosha, he can't get married in the family. Pre-occupation screening, focus on young and advanced maternal age, use of alcohol, tobacco smoke, residence of outdoor, indoor air pollution, ultrasound in the first trimester for any defect, second trimester for any severe fetal defects. Neonatal screening soon after birth, we have hearing loss, congenital cataract, metabolic, hematological, endocrine disorders. We have screening is being instituted now nowadays. Some severe congenital disorders need multicentric professional support. Some congenital disorders can be prevented. Important vaccination, especially for the mother, giving the tetanus is the most important. Tetanus vaccine will give. Adequate intake of folic acid, iron, iodine, and adequate care before during pregnancy is a very much aligned with the nutrition. And also empowering the people with the disability through the nature is very much important. Why you can see the baby with handicap, with the mother, how is enjoying the farm. I think role of green spaces environmental issues is very good. We have to maintain green spaces. I think we approached about Karnataka, we approached 1,209 villages. No green space there. What is called Bomanas, they have all gone. So every city should provide enough greenery, space per person with easy, safe accessibility. Public green spaces are the parks, woods, plazas, forests, playfields, which helps to improving the both physical and mental health by giving an opportunity to connect with the natural world. It provides a safe access to green public places to everything, in particular women and children, elderly people, people with disability. right place for a social activity which helps in breakdown of cultural barriers, promotes education to be environmental friendly, enhances the critical thinking and creativity. Green Park is very much living in Indian science. So, who made the garden of the year? Maharaja Mysore gave this. Who did the garden? Krumbigal. Have you heard of him? Krumbigal. In Lalbagh, his museum is there. Krumbigal is German. He came here, Maharaja of Mysore, he brought it. He planted all the plants here. KRS Dam, he did it. Mysore Palace and Akbar Park, he did it. Jubilee Park, all the parks he did. First state of Mysore, Horticulture Association, he started. He's our Rotary Club president also. And air quality in Mexico. Air quality in Mexico in 1980-89, it was very bad. Now when I went there, 34. American quality standard they followed. American less than 100 is satisfactory, more than 100 bad. What is Bangalore weather as of today? 1135 I got air quality index here. For pollution control I get every day. I think Bangalore quality is good and satisfactory. Only one place, that is Silk Board area, 173 is there. That is moderate pollution. I think mainly from the particulate matter 10, all over the area, particulate matter 10 is the one. About the area is 37. So that Mexico City was the earliest most polluted city is improved. I cleared it. So I went through, that city stays 7,400 feet above sea level and dry and comfortable weather year round. I really enjoyed it. I went there 48 kilometers away from the city. The pyramid is there and you can see this beautiful. You can see the pyramid. Clean air is there. I think they committed. Everybody worked for it, clean up the air. That's it. We have to do that. We have to learn lesson from them. In addition, I learned a lesson here. I was in a conference hall about 15 conference sessions. It's a V-shaped. You have to go 700 foot, that's in the center area, sitting area. I finished one talk, I was going to the other one. At that time, this young man came, sat next to me. I looked at him, he has got a tube, oxygen going around, and the back carrying the oxygen. Then I asked him, are you carrying a seeker? Constant positive airway pressure with oxygen. Yes, I'm carrying that. Why are you carrying? You have some chronic lung problem with oxygen deficiency. Yes, I've got a lung pulmonary fibrosis. It can I not have a transplant? I cannot do that one. He's a professor of pediatrics in Mexico Medical College. Now we always said teaching never is until last breath. Look at this man coming to learn. That made me very happy. Our statement holds good on that one. And then he coughed. Then I said, I think his cough is not this is not a restrictive cough, an obstructive component also. How do you know? I'm a pulmonologist. I've done a cough module training people all over India. I can mimic 6 varieties of cough, how it looks, anything like that. You can diagnose it. Yes, you're right. I have an obstructive problem. My doctor gives a puff and all this, I take it. So by cough only you diagnose. That's what we always say that investigation are only supportive evidence. They cannot overtake clinical. He said, Dr. Paramesh, I use your picture and your statement. Clinically, you don't know here's a man diagnosed without any investigation. Investigation is needed to prove it. But clinical judgment is very clear. We have to spend little time in this situation. Ladies and gentlemen, thank you for your patience hearing. Let's go with the positive thinking. Protect our Mother Earth. Pursue research, sustenance lives. Think locally, act locally, propagate globally. Any good thing otherwise, we'll take it. And we propagate the national ethos. One planet, one family, one future. We have to safeguard it. Thank you very much for your time. Any questions? I'll be happy to answer.